Have you ever wondered why some people get to live these long, healthy lives while others just don't? Is it all down to our genes or the choices we make? Well, that's exactly what we're diving into: the data, the philosophy, and the really tough questions behind why health isn't always equal. All right, let's kick things off with a number that is, honestly, pretty shocking. 15 years. Get this. In Marin County, California, your life expectancy can swing by a full 15 years, just depending on what neighborhood you live in. And we're talking about neighborhoods that are only 8 miles apart. So what do you do with a number like that? A 15-year gap. It forces you to ask a really big question. Is this just the roll of the dice? Bad luck for the people in one neighborhood? Or is this something else entirely? Something that points to a fundamental injustice in how our world is set up? That question is really the whole point of our conversation today. Now, to even begin to answer that, we've got to make sure we're all speaking the same language. You know, experts in this field use very specific words to talk about these health differences, and getting them right is absolutely key. So let's break down the vocabulary. So first up, you've got this term health disparity, and you can think of it as just the facts, the raw data. It's a difference in health that you can measure between different groups. That 15-year life expectancy gap, that's a health disparity. It tells us what's happening. Okay, but here's where it gets more complicated. The next term is health inequity. This goes way beyond just a simple difference. An inequality is a difference that is avoidable, unfair, and unjust. It has a moral weight to it. It tells us that this difference shouldn't be happening in the first place. So let's put these side by side. It's really simple when you break it down. A disparity, that's just a difference. It's a statistic. But an inequity, that's an injustice. The most important word there is avoidable, because when a health difference could have been prevented and should have been, it stops being just a number and becomes a question of fairness. Okay, so if these gaps are avoidable injustices, the next logical question is, how do we fix them, right? And our gut reaction is usually to think about, doctors, medicine, hospitals. But what if that's only scratching the surface? This is where we get to a much deeper idea about what health really is. And, the celebrated physician Paul Farmer, he summed up this conventional wisdom perfectly. He said to solve health problems, we need more stuff, staff, spaces, systems, right? More clinics, more doctors, more medicine. And look, of course we do. That stuff is absolutely critical. But, and this is a huge but, what if that's not enough? The twist is that even though all that stuff is necessary, it's often not sufficient. You can't just drop a bunch of resources into a community and poof, everyone's healthy. It just doesn't work that way. Because there are other, much deeper forces at play. This is where a philosopher named Sridhar Venkatpuram comes in with a really powerful idea. He says we need to stop thinking just about healthcare and start thinking about the capability to be healthy. This isn't just about whether there's a hospital nearby. It's about whether you have the actual real-world freedom and opportunity to be healthy in your day-to-day life. And this is what that actually looks like in the real world. This example from a neighborhood in Omaha, Nebraska is fascinating. Residents there were dealing with high rates of diabetes. And look what they said the barriers were. Notice anything? Not a single one of them is about lack of doctors or hospitals. It's about not having safe places to walk, parks that feel dangerous, unhealthy food being the only option at church. It's the very environment that shapes whether health is even possible. So this idea that the system itself creates barriers, it's not just some philosophical concept. We can actually see it in the data. And for this, we're going to look at an amazing study from northern Sweden, a country that's famous for its taxpayer-funded universal healthcare system. What the researchers wanted to test was this really core idea called horizontal equity. It sounds fancy, but it's super simple. It just means that people with the same health problems should get the same level of care. It shouldn't matter how much money you make. Equal need, equal treatment. Makes sense, right? And when they first looked at the numbers, everything looked great. They found that, overall, people with lower incomes were actually using healthcare services more than people with higher incomes. Which, kind of makes sense, since poverty and poor health often go hand in hand. So it's a pro-poor system. Great news. So case closed, right? The system is equitable. Well, not so fast. The researchers decided to dig just a little bit deeper. And this is where things get really, really interesting. And this is where it gets wild. Once they started comparing apples to apples, so people with the same level of health need, the story completely flipped. Look at this. For big stuff like hospital stays and specialist visits, yeah, it was pretty equal. But for just a basic trip to the doctor, to your GP, there was a clear, statistically significant pro-rich inequity. That means even when they were just as sick, wealthier people were getting to the doctor more often than poorer people. It's this tiny crack that reveals a much deeper problem, even in one of the best systems in the world. And hey, this isn't just a Swedish thing. This kind of challenge pops up everywhere, even in countries that are knocking it out of the park on healthcare. For another great example, let's hop over to Japan. I mean, Japan's health story is just remarkable. They got universal health coverage done way back in 1961, and for years they were hitting #1 in the world for life expectancy. But now, they're facing this perfect storm of a tough economy and a population that's aging incredibly fast. And that's the thing to remember here. Japan's success, its equity, it didn't just happen by magic. It was built piece by piece over decades through deliberate social policy. But now, all these new pressures, the same ones lots of countries are facing, are threatening to pull that very foundation apart. In this chart right here, wow, it just lays the problem bare. In a little over 20 years, the share of the population over 65 more than doubled. Just think about that. You've got fewer working people trying to support a much, much larger older population. The strain on the entire system is just immense. Okay, so let's pull all of this together. We've seen some shocking numbers, we've defined our terms, we've looked at data from around the globe, and what it all leads to is a complete reframing of the problem. At the end of the day, here's the big takeaway. When the system itself, the way your neighborhood is designed, what food is available, how easy it is to see a doctor, when that system creates unequal conditions, then the health gaps we see aren't just about bad luck or people making bad choices. They're a direct result of the world we've built. And that right there, that leads to the final most powerful point. Like Sridhar Venkataparam says, this way of thinking totally elevates the question. We're not just talking about healthcare funding or poverty anymore. We are talking about basic justice. So I want to leave you with a question for you to take with you. Just look around your own community, your own neighborhood. What are the things, the parks, the sidewalks, the grocery stores, the social vibe that help or hurt your real, genuine freedom to be healthy?